Hashmi speaks, and then I think there'll be some time for some questions. So at that time, you can just unmute and engage as you would like. So I'm going to just take a moment and introduce you, Senator Hashmi. We are excited to have her with us. She is an educator and she serves in the Virginia Assembly. She represents the 10th Senatorial District, which includes parts of Richmond City, Chesterfield County, and all of Powhatan County. She sits on the following Senate committees: Education and Health, Agriculture, Conservation and Natural Resources, General Laws and Technology, and Local Government. Senator Hashmi also chairs the Senate Subcommittee on Public Education. As an experienced educator and advocate who spent nearly 30 years working within Virginia's college and university system, she identifies education, equity, the environment, and healthcare access as top legislative priorities. Senator Hashmi was elected to office in November 2019. Prior to her election, she has served as the founding director for the Center for Excellence in Teaching and Learning at Reynolds Community College in Richmond, Virginia. She's also the first Muslim American to serve in the Virginia Senate. And so I'd love to welcome Senator Hashmi. I will say she has been working around the clock, putting forth some really groundbreaking and exciting legislation for the state of Virginia. So we're grateful for your service, and we're grateful for you to be with us early on a Saturday after you've been working through the hours last night. So thank you. I'll turn it over to Senator.
Thank you so much, Katie. It's great to see everybody, and I'm honored to be asked to join you. I remember coming to this conference, I think it was maybe 4 or 5 years ago, and just so impressed by the work and the leadership that many people were presenting and speaking about that day. So thank you for all the incredible work that you're doing and all the volunteers. Such an essential role that you're playing in helping our new immigrant communities integrate into Virginia and to find a new home and to establish themselves and make space for their families. So I'm just honored to join you. I'll begin this morning. I'm going to be talking about the Office of New Americans, which was established last year legislatively and has just recently, within the past, I think about 7-8 months now, begun its work. But before I do that, I would love to talk a little bit about my own immigrant experience. And I was looking through some of the data earlier to see how many foreign-born Virginia state senators we've had. I'm sure in the early 1800s, probably there were some foreign-born state senators in the General Assembly, but more recently, I couldn't identify too many people. I need to sit down and do more research, but currently in the Virginia State Senate, I am the only foreign-born, not just born outside of Virginia, but born outside of the country, member of the Virginia Senate. And I think that's important. I think it's important because of the issues of representation and the kind of perspective that I can bring. And I'm very conscious of the fact that I represent a group of people who has historically not been really represented widely, whether it's in the Virginia Senate or in the entire Virginia Assembly. We do have about 5 or 6, I believe, foreign-born delegates. And so it is increasingly becoming more reflective of the kind of Virginia we have. But my own immigrant story begins in the 1960s. My father came to the University of South Carolina as a graduate student, pursuing a PhD in the field of international politics. And his entire perspective was that he would get his degree and then return back to Pakistan. When he made the decision to come to graduate school in the United States, I was born on the same day that he received his fellowship to University of South Carolina. So he had two choices and two paths in front of him to leave his young family, his wife and my older brother, and myself, now a newborn infant, or to remain in Pakistan and make that choice. He chose to come to the United States for his education. He left the three of us behind, and so that he could focus on his studies here. And of course, as a graduate student, he was living on pennies at that time and couldn't really afford to bring a family. So I actually never met my father until 1969. I was 4.5 years old, and he had just received his first job teaching at Georgia Southern University, and he had his family come and join him in Georgia, which is where I grew up then. I started kindergarten there and spent all my school years in Georgia. But my dad did something interesting. You know, once he had made the decision to stay in this country and to become a part of it, he still wanted to leave that choice of whether to become an American up to myself and to my brother. So when he became an American citizen, he didn't automatically have his minor children, my brother and I, become citizens along with him. He told us that he wanted this to be our decision, that we had to make up our minds for ourselves, whether we wanted to be American or decide where we wanted to live in the world. And so I remember actually making that conscious decision. I was in college, and up until then, I wasn't sure if I was, what my path was going to be, where I wanted to live. But I thought that was important, that my dad left that choice up to us. And it became a matter of pride for me that I made a conscious decision to be American, that I had at that point in my life evaluated what it meant to be a part of this country, what the ideals were, and how they helped to define and shape me. So along the same time that I made the conscious decision to become an American, I also made a conscious decision to focus my graduate work on American literature, because I became very, very engaged with the idea of where this idea of Americanism or Americanness comes from. What is the philosophy that shapes it? What are the ideals of democracy? How do the narratives of our historic past shape our identity as Americans? That all became a part of my academic efforts. And so both of those items came together for me. And I think that's been a really critical part of helping me to decide to enter into the field of government and public service. After spending 30 years in higher education, I saw the ways in which government was working and not working for so many Virginians. I was spending close to 20 years in the community college system, where I encountered so many students of very different backgrounds who needed assistance, who had the ambition and the talent to do effective work, but were stymied by the kind of policies and government inaction that we had. And so that was part of my transition into this area. And I'm so pleased that I've been able to be a part of a General Assembly last year as well as this year that is really making important strides in significant ways. So I'm going to talk a little bit about the Office of New Americans, and then happy to take questions from you and discuss it further. I began last January was my first assembly, and I was so pleased to be approached by Delegate Kathy Tran, who had been working on legislation for the Office of New Americans for at least a year or two. And with a Democratic majority, we saw the opportunity to be able to pass that legislation last year. So Delegate Tran was carrying it on the House side. She asked me to carry the legislation on the Senate side. The Office of New Americans is now a part of the Department of Social Services. But interestingly, what we also realized what we could do is make it a, increase the collaboration between DSS and the Office of Diversity, Equity, and Inclusion, the new office cabinet position that had been established recently by Governor Northam. And so this, the ONA is actually a very interesting bridge from Department of Social Services and its efforts in refugee services, as well as new immigrant services, and the Office of Diversity, Equity, and Inclusion, because we realized that policy development in this area really had to include all of those important conversations around equity and inclusion, and emphasize the ways in which Virginia has become increasingly a diverse state. So in making that collaboration, then we saw the opportunity to bring new staff members who could help to establish the office fully. And one of the positions that is really critical is funded now through the Emerson Collaborative, which I'm sure many of you are already quite familiar with. The Emerson Collaborative has been working with offices of New Americans across several states. I believe there's 10 or 12 such offices established in other states, and it funds a position for the director of policy that is helping to set up this new office and to increase that outreach and growth of it. So in this particular setting recently, we just have hired Mona Siddiqui, is our Deputy Chief Diversity Officer, as well as Senior Policy Advisor. She comes from A.G. Herring's office. She was formerly an Assistant Attorney General. And now she's heading up this new office to help us get the ONA grounded and moving forward, and also then reaching out across to the other states and seeing what their ONAs are doing as well. So it is a complex and interesting project. It's moving in a lot of different directions and has important potential. So what is the ONA designed to do? It's really it's designed to focus on new Virginians, new immigrants who need assistance and support, whether it's finding housing, having access to education, to English as second language materials that you were just talking about, to helping children get acclimated into their schools. But it also has a very strong civic engagement portion as well, because the title serves its purpose. These are new Americans. What do we want them to do and in order to integrate effectively into our communities, and how do we want them to feel invested and a part of the new communities in which they're living? So it's serving many different aspects in its efforts. The ONA has also recently established its board of advisors, and those are 18 non-legislative members, and Katie's one of them, I know, and there may be a few others on this call today who are already on the board as well. But I know they've met at least twice that I know of, if not more times, and have started the good work. But in addition to these 18 non-legislative members, we also have representatives from the Virginia Asian American Advisory Board. The chair of that is on the board. The Latino Advisory Board, its chair is also a member of the ONA board, as well as the African American Advisory Board and the Council of Women. So this advisory board really seeks, in a way that the other advisory boards, interestingly, don't do, it pulls together a lot of different voices, a lot of different experiences into helping Mona Siddiqui, as well as the Office of Diversity and Equity Inclusion and our DSS, to develop the strategies and the plans of the new office. So I'm very excited about the work that it is doing and going to continue to do. As we all know, immigrants in the Commonwealth are so essential to the state that we have here. I think recent data shows that 13% of Virginia residents are foreign born. That is about just over 1 million of our population is foreign born. And it's significant when we take a look at the ways in which immigrants are so much a part of the Commonwealth's efforts and its different roles. We have immigrants that play a significant role in small businesses throughout the state, and in education areas. Healthcare professions are see a great deal of diversity from immigrant representation. And increasingly, we're beginning to see a lot of immigrant perspectives in government as well, whether elected office, as I talked about earlier, or in different positions throughout our government, whether it's state or local. And so it's become a much more diverse and different perspective than we had maybe 10, 15 years ago. I'll talk a little personally about my own experiences in this area and some of the policies that have resulted as coming from my experiences. As I mentioned, I was in the community college system at Reynolds Community College, and specifically. And over the course of 20 years, I had so many students who came with very interesting backgrounds, challenging backgrounds. During the early 2000s, of course, with the wars that that the United States was engaged in, you well know we saw an influx of refugee populations, whether it was from the Middle East or from countries in Africa. We saw a significant resettlement effort right here in Richmond. And so many of those students were transitioning through Reynolds Community College one way or another, and were in my classes. I have great friendship in the ESL department. They did a wonderful job of helping prepare these students, and then they would come into the credit courses. And it was in working with those students that I saw the challenges that many faced, whether it was the need for financial resources, access to employment opportunities, access to transportation. Richmond is just not hospitable in many ways with a lack of effective public transportation. I had students who would walk miles to get to the campus or ride bicycles, shared bicycles. There's one tremendous story we have of a Reynolds graduate who he and his brother had resettled from Afghanistan, and they had one bicycle between them, and they would take turns coming to class and working in janitorial services late at night and doing their homework and everything. And eventually this young man went to VCU, was admitted into the Medical College of Eastern Shore of Virginia, and is now a practicing cardiologist. So a tremendous success story of the great potentials that so many of our students have and the talents that they bring. But one thing we saw at Reynolds that was really just disheartening to me, I had so many students when I worked as a faculty advisor who were undocumented students, and I never knew they were undocumented. We didn't, that wasn't a matter of record collection or data collection in terms of our admission policy. But when they were getting ready to graduate with a 2-year degree, I frequently had students who would just break down in tears in my office because that was the end of the road for them. They and their families could struggle and pay the tuition of a community college degree. But when it came time to go to a 4-year institution, they simply could not bear the cost. They had to pay out-of-state tuition, and it was just out of reach for them. So that was the end of the road. I had very smart students who had the potential to contribute to Virginia in many ways, whether in business or in the healthcare. Many of them wanted to be physicians or wanted to go into law and practice. They really could not continue in their education dreams. So one thing we did last year, and this was a legislative effort that had been in the works for many, many years, is giving our undocumented students the opportunity to pay in-state tuition. That was huge. It was huge to make that effort possible. It passed on a very partisan vote, but having that in place and all of the advocacy that was around it was just tremendous. So in-state college tuition, giving our undocumented individuals the opportunity to be Virginians, basically, because these were part of the qualifications were that they had to have graduated from high school here, had to have spent at least 2 years of high school in Virginia, and that they or their families had to have paid state taxes. And they were doing that. They're paying taxes, but not getting any of the opportunity or the benefits. So we have that now in place. I'm excited to share that the next step is happening this year. And we just passed this bill out of the House. We passed it out of the Senate. We do have to now, we're just in crossover. So we'll be bringing both of the bills together. The same students now are also eligible for financial aid, because we well know that giving in-state tuition opportunity is still a huge cost for many families. But now these families and these students can apply for financial aid, state level financial aid, of course, not federal level. But this is big, and it's something that our universities actually asked for. We've had college presidents pushing for it, both private and public presidents asking that we allow the students to be eligible for financial aid. As Virginia's college enrollments are declining, we are missing a significant opportunity by erecting barriers to a huge part of our population. And this is a population that we want to have educated so that they can get skills and credentials and help shore up our workforce. We have tremendous gaps in our workforce in Virginia, whether it's in healthcare or education or in manufacturing technology. We need these people. We need them educated. We need them to be a part of Virginia and a part of the contribution of moving this economy and this growth forward. So I'm really excited about that effort. The other thing we also did last year was to give driver's privilege cards to undocumented individuals. Again, helping them to be able to roll over and not having any kind of identification, excuse me, on them. So again, a very controversial and very challenging piece of legislation, but I'm so pleased we were able to get that passed. I'll stop in just a minute and take questions, but I just also wanted to highlight some of the ways in which the pandemic has exposed the kind of crisis and critical needs for so many folks that live in our communities. As you well know, many of our undocumented families are existing at the margins of our society, and they're often unseen and just invisible in significant ways. And so when the economic relief packages, the stimulus relief to families was delivered, we have many families who did not receive any relief. They've continued to work. They've worked without health care insurance and have borne the brunt of not just the disease, but also the economic fallout that we've seen in the Commonwealth. And so they're just humanitarian needs that exist and that have been exacerbated by the crisis that we're all feeling. So lots to do, and we sure couldn't do it without the good work of volunteers such as you. So I thank you for everything you're doing. And I'll just stop and happy to take questions.
Thank you, Senator. You all can feel free to just unmute and speak out your questions, but I'll also be monitoring the chat if you'd rather post your question in the chat.
I've obviously stunned people into silence. I have drifted you off to sleep.
Wouldn't mind asking a question. I'm a volunteer with Reestablish Richmond, although I'm not one who did a lot this year, but given COVID. But I was wondering about the ONA in a couple of aspects. If it's adequately funded, if there's ways in which we can support that. And you mentioned it, some of these things are partisan votes that are very close. I was wondering if you feel your colleagues are listening to the board of the ONA or listening to you on these issues.
Well, thank you. That's a great question. So initially, there wasn't a tremendous fiscal impact on the Commonwealth with the establishment of the ONA because it was built right into the system of Department of Social Services, and the existing staff was designed to help lift it up and get it implemented and started. So one thing that we've been very fortunate is by, and this was Delegate Tran's efforts, I give her full credit for this. She realized that we could reach out to the Emerson Collective, and their fellowship program actually created the space for us to hire a full-time individual, and that is Mona Siddiqui. So that is a grant-funded position that we have, and I believe it's for 18 months, if not for 2 years, where Ms. Siddiqui is able to establish and grow the program. And then through the Office of Diversity and Equity Inclusion, there were 2 other positions that were built as support systems, both for the Office of Diversity, but also to help in the ONA. So it hasn't had a huge fiscal impact because we can use the existing resources that the DSS already has and leverage those. But as far as what the ONA board is doing, and I think, Katie, you might be able to speak to this a little bit better than I can, but it is really designed to help bring those perspectives, bring those areas of need as people of the faith community are represented, and so many individuals from geographic representation as well. But I'd love to hear, Katie, what you see happening with the board's role.
Yeah, thank you. So I'm excited about the board. The board definitely is very representative of the immigrant communities, and there's a lot of voices, diverse voices that are spoken. And we have met, but we haven't actually dug into a lot of the work yet. I know that some of the priorities that we're going to be looking at is definitely looking at language access and ways that we can improve that across the state at various places such as like the DMV and other government agencies. But we are having a lot of questions coming in the chat. So I'm going to look over. Sister Leah is wanting to know, how can refugee families receive help from the ONA? Is it open for appointments, or is a website or phone number where someone can at the office can be contacted?
So I know the website is in development. I've seen just a little bit of the language available on the ONA website. So that is certainly one access point, but calling the Department of Social Services is probably the best way to reach the ONA. But if it's assistance for refugee resettlement issues, that is already in existence in the DSS, the Office of Refugee Resettlement. And so that has tremendous resources, both for all of the areas that we talked about in terms of social integration, education integration, and also setting up pathways to establish businesses and so forth. So the ONA is working very closely with the Division of Refugees Resettlement, but it is also then extending beyond our refugee community into the population of immigrants that we have.
Question, Catherine Wimett is wanting to know, what about healthcare for undocumented people? Are there efforts to provide more support for free clinics? Where do they stand with getting COVID vaccinations? Many are afraid to come forward to seek these privileges.
Absolutely. We know the anxiety and the fear that are part of the undocumented communities, but the clinics are running for the vaccines, and those are available. People can make appointments. Well, the VDH is still working on that portal for folks to register for appointments, but they are able to, when we have the large clinics, as we did just last weekend, I believe 5,000 were vaccinated in the Richmond area, and then Chesterfield County also had about 2,000 to 3,000 vaccines last Saturday. But they can go to those clinics and receive the COVID vaccine. And as far as the health insurance, that's an area we need to work on, access to health insurance, not just, as you well know, not just for undocumented individuals and low-income individuals, but really for all Americans. We have a healthcare crisis in the country, and that needs to be addressed.
Thank you. I will add, I know, Kathy, that we've been in contact with the health department this week, and they are going to be having a COVID vaccination event for immigrant communities over age 65 next Friday. And I think there are still a few slots open. So we're going to be sharing that information out to the communities that we work with. And then we're also working on having some language specific COVID vaccination information sessions that we'll be sharing out with the community in the next couple of months as well. So hopefully that will be some very small ways that we can try to get this community more educated. Any other questions, Susan? I'm responding to your question via chat about the driver privilege card, just to let you know what you missed when the Zoom froze up.
And just speaking about the challenges of getting the information out, you've highlighted already the many different languages that are spoken and read in Virginia, and being able to share information is a challenge because we're just now becoming conscious of the need to have all of this information in all of the various languages that are spoken by immigrant communities. And that was, again, part of the pandemic rollout, this sudden realization that if we're going to educate people on how to stay safe during the pandemic and how to access resources, whether for business or for health needs, that it had to be available in a wide variety of languages. So I had asked our VDH to put the information at least in the top 6 languages that are spoken throughout the state. And they were already working on that measure, but I know that Dr. Janet Underwood, who heads up our Office of Diversity and Inclusion, was very instrumental in helping to push for representation on linguistic levels as well. And so that is now, it's interesting to me every time now that legislation is coming out, we're seeing more legislators include the linguistic aspect in it, that if we're going to be educating people on or passing information, that it has to be in a variety of languages so that we reach the populations that need to be reached.
Thank you. We have a question from Molly. Molly, you might have to clarify the question because I think there's some education speak that I might not understand, but her question is, what do you think makes the most impact as far as transformation for a context that is historically not used to meeting these needs, specifically with SCHEV, aiming Virginia to be the best educated in the state by 2030? And how do refugees and immigrants, how they are and aren't part of this, and how policy and advocacy helps? Do you need clarification?
I think I understand, but Molly can help me if I'm missing the boat. But just speaking to the role of SCHEV, the State Council of Higher Education in Virginia, SCHEV has been really very much a part of this discussion. They were extremely supportive behind the scenes for the move for in-state tuition. The in-state financial aid eligibility for undocumented is one of their top priorities as well. And so they have really brought a lot of people, the stakeholders, to the table and helped legislative action work with representative individuals from our institutions. And so their role has been significant. And I'm sorry, Molly, I'm forgetting the other part of your question.
Thank you so much. I come from an international higher ed background. So I left the US in 2017 and came back in 2019 and actually live in Pennsylvania now. But I grew up in Powhatan. So I know you represent Powhatan. So I've been scattered around the Richmond area and Powhatan as well. But still volunteer with Reestablish Richmond through this. So thank you for all that you're sharing. But specifically, my question was about education. So thank you for addressing that. But I'm really curious about beyond education. What do you see that we as volunteers could make to make the biggest impact? Not just about education, obviously, but there are these gaps and needs. And as someone who grew up and left and came back to Richmond and has seen this transformation, even if I had never left, obviously it's happening, but you mentioned some of the gaps. So as volunteers, I wonder what we might do as far as advocating for these policy changes or educating ourselves or whatever, but beyond education, because it's obviously something where the gaps are still there. There's been a lot of amazing progress made. Just so impressed by just the past couple of years, the progress that's been made. So if there's something that we might do as volunteers, I'd love to know.
I can't tell you how very important your voices are in this whole conversation. I can't say that enough times because as volunteers, you're in direct contact with the individuals, with their life stories, with what they're going through right now, the needs that their children have, their families have. being able to speak to those stories and represent these individuals is paramount. So I see the role of volunteers in two ways. First, whatever it is that we are able to enact policy-wise and the resources that are available, being able to direct those resources and that information to these communities is absolutely essential, because so many times people just don't even know what kind of resources are available to them in order to be able to access it. And so that's critically important. And then the flip side, of course, is the advocacy that you bring, and being able to connect with your representatives. What works most importantly or powerfully is when constituents speak directly to their representatives. We get a lot of blanket emails. I get at least 200-300 emails a day on topics that are controversial, but they all say the same thing, and they're just cut and paste and sent out through these channels. But when a constituent of mine personalizes the email or the phone call and speaks directly to an issue, and the way it impacts them and their community or people that they represent, that's so much more meaningful. None of these are partisan issues, and I'm always surprised when the votes always come down on partisan lines. But I think many of our legislators are not hearing from one side or the other. They're not hearing, they don't realize that in their districts, they have communities that desperately need these resources and this assistance. And that if we're able to do that through policy, through legislation, that will be of benefit to the entire state and to their district directly. So being able to communicate that to them, representing and highlighting the ways in which it impacts them is important. And hopefully we'll break down some of these partisan concerns that we have one way or another. I hope that answers your question.
Molly also added, if it's not too personal, I think a lot of people are curious about this. What convinced you ultimately to become a U.S. citizen? You know, I think some folks out here have friends and relatives who are trying to decide, and they just want to know from your perspective what do it.
It was a challenging decision for me in some ways, and it is personal in some ways. I grew up in Southeast Georgia in a very small college town, and there was no one like me at all. My family was the only South Asian family, and I think we were maybe one of two immigrant families in the city. And it was such an isolating childhood. I took refuge in books. You see the books behind me. That was my personal library started when I was young, because it was just a very, very lonely childhood in many ways, not having that kind of representation. So at one point when I was about 14, 15, I actually had planned to return to India and live with my grandparents. I wanted to go to high school there. I thought I'd go to college there. And it was because of community. I loved my cousins. I loved the excitement of a large family and being with people who looked like me and had names similar to mine. So I was very torn, and my parents left that decision up to me. I was on the verge of doing that. I'm not exactly sure what persuaded me to not go to high school there. I had a return plane ticket, so I came back to Georgia. But I ultimately decided, and I think this is part of looking at, as I immerse myself in the ideals of American democracy, what shaped American ideology, the philosophy, the writers such as Emerson, Thoreau. I realized that even though culturally I felt very connected to my Indian heritage, ideologically, philosophically, I was nothing but American. I was purely grounded in those American ideals, and that this country, through those ideals, reflected who and what I am, and I understood that, it, you know, as in an intellectual way, as I was being shaped by what I was reading and working through. I think that answers, Molly. I hope that answers.
And I have a kind of a brief question, just to touch on the point you mentioned about isolation. As an immigrant myself, I think that's something that a lot of young children, immigrant children, can relate to, and even adults as well. So I'm just wondering, with the work that ONA is doing, is there a focus on how immigrants can build community with one another, like across, nationality lines, and also talking about the mental health aspect of being an immigrant, also being a refugee as well, if that's coming up in conversations?
Yeah. Thank you so much. That's an excellent question. Mental health issues are very much a part of the conversation because it helps in the ability of individuals to feel connected, to have a sense of the resources that are available to them. But one thing I am really, really pleased about, as I might have kind of hinted at earlier, in the context of the board, and I see Eric is here too, so I know Eric is on the board as well. But one thing I love about the board is that it's bringing together, and I think Eric, you'll echo this, is bringing together the voices of the Virginia Asian Advisory Board, the Virginia Latin American Advisory Board, the African American Advisory Board. And this ONA board then becomes very comprehensive in that regard. It's a large board, 18 members plus the ex officio members, but it's bringing together. So when you have May Navar, for instance, who is the chair of the Asian American Advisory Board now, who has succeeded Eric in that position, when you have her sitting on the ONA board, she's able to bring all of the efforts that VAAB has been doing for many years effectively into this space as well. And I think that collective voice, that collective identity is very much a part of what ONA is now seeking to do. And it's a young board right now, just getting started.
Thank you.
Thank you for answering the question.
Marilyn Breslow brings up a topic that's definitely dear to my heart as well. And it's the cost of interpretation. So, providers, healthcare providers, talk about the balk at the cost of providing language access. And I think her statement was just that we really need to educate Virginians on the cost of not providing interpretation and ensuring understanding. Health problems misdiagnosed and incorrectly treated, children's learning needs ignored, etc. Do you have any comments or like to talk about that issue?
Thank you, Marilyn. That's such an excellent point. And, it's something that often flies under the radar for a lot of us. And I know the translation services that are often employed by the healthcare industry is on a volunteer basis, and having people that can come in and help. And that's not the effective way. So I made a note of that because that is an area of policy effort that we might actually be able to do something and be able to work in. So I would love to chat with you further and see how we might be able to effectively help to support translation efforts within our healthcare professions. And I imagine we would have a lot of good support from our physician communities and from our other healthcare industries, and be able to set something up in place to have a more formal, more structured process in place. So I've made note of that, and I'd love to chat further. And this is one thing I would want to say too, for anybody here, the ideas for legislation really come from our communities, from our citizens. And everything that I have worked on has been because of outreach from people in our communities who say, here's an idea, this is something we need to have done in Virginia, what can we do? And we start that conversation. So I would welcome any of you, if you have ideas and want to discuss policy proposals for the next year, to certainly reach out to my office and we can begin that conversation. We are a citizen legislator to begin with. We work part-time, and everyone is supposed to have their own jobs. I'm presently haven't been able to figure out how to balance the work in the General Assembly with another job, but I will have to do that soon. But it is really designed, the Virginia General Assembly is designed to be an inclusive and participatory legislature where we have members of the community playing an active role in designing the policies and the legislation. So please reach out if you have any ideas.
Thank you so much, Senator. We are going to wrap up our time with you. We're excited. Our 11 o'clock session is our Immigrant and Refugee Roundtable. So we'll have some individuals from our client communities sharing their stories. So if you want to, it's going to be on this Zoom call. Correct me if I'm wrong. So if you want to take a break and then hop back on at 11, I think we're going to go ahead and wrap up this session. Thank you so much for your time, Senator. We wish you the best as you continue your good work. Thank you so much.
Thank you. Thank you all for all the good work you're doing.
Sharon or folks from the IRC, do you all have further instructions about what people can do if they want to stay on? Should they just stay on this call?
I will end this one since we're recording this one and not the next one.
Okay, perfect.
So I will be ending this meeting, but immediately restarting it and helping us get set up and make sure all of our participants can join.
Okay,
So,
great.
So it's the same link if you're registered for the Refugee and Immigrant Roundtable as a participant. Just go ahead and log off and log back on.
Thank you.